project under the Women's Empowerment Desk, and through that project we received the opportunity to travel around the settlements, and we were able to have discussions with the youth, the women, and also the elderly. So while we were talking with them, we asked them specific questions related to gender, and we asked if they differentiate between boys and girls, and we also asked them if they think there's a difference between boys and girls. And the answer they gave us was that they think there are no difference between boys and girls. But when we got to specific questions like who does what and what kind of roles do you subscribe the specific gender to, then we came to realize that they did have a lot of differences, and they did prescribe certain rules to specific genders. And when we asked them questions whether they think there is a prevalence of sexual violence in our community, like rape, domestic violence, they told us that they did not face any of these issues in their communities. They also told us that these were issues of the past. They didn't face it anymore. But but after we had finished our discussions and after we had gone to the settlement officer's office, he tells us that they had faced these kind of issues just a few months back. So we realized that the community still continues to hide these issues and are not open about these issues, and feel that there's some sort of shame if they were to expose issues like that in our communities. I think it's much easier to work with children than it is with working with adults, because children are still at that stage in their life where they're open to new ideas and perceptions, and they're still critically evaluating a lot of the issues that they are fed. So it's not that difficult to talk to children, and they have a lot of questions they have a lot of curiosity, so they ask us a lot of questions. So they're still open to a lot of ideas that we share with them. But with the adults, they're of the ideas that they already somehow know how the world works, and whatever they were conditioned to accept is how the society should be. So they get a little hostile, but if we're able to connect some of the issues from their own lives and tell them that this is not how things are supposed to be, they take a step back and sometimes are able to reflect on whether this was actually harmful or whether this was actually something that was normal. So these are the challenges we face, but there's still a lot of hope, because I think we're still at the stage where we're only just learning about what gender is and what gender equality is all about. So we conducted the study with 401 students from 5 Tibetan schools, and most of these schools were located in the northeast part of India. And so in these 5 schools, the 401 students that we surveyed, out of 401 students, we found that 151 students had admitted to have faced incidences of sexual violences. So even from that category, the nature of experiences were really different. The maximum number of students said that molestation was one nature of that sexual violences that they had faced the most, and then second was eve teasing, then came rape, and then came other issues. So they were all of these were issues that they had faced in their lives. And this was not specific to schools, because we asked them who were the accused in these actions, and then perpetrators, yes. And so they told us that it turned out that they said that most of these people who committed these acts against these children were people they knew. That was about 75% of the accused. So it wasn't strangers who committed these acts against these children. These were people that they knew. We also asked them if in future, if they were to face any kinds of sexual violences, would they be open to sharing it with the school authorities? Only 5% of them said yes. So I think there is a lack of trust among students with the authorities. So the school too needs to really put a mechanism in school whereby the students feel secure and know that they can share their problems with the authorities so that they can get support and help from them in the future. So children as young as 4 years old had faced issues of sexual violence. So these are issues that we discovered from only after visiting only 5 schools, after surveying only 5 schools. Can you imagine if we were to conduct the same kind of study in the rest of the schools, how many more issues could come to the surface? So that is the extent to which the prevalence of sexual violence is in our community. So there's a lot of work that we need to do on issues of sexual and gender-based violence in our community. If I'm truly honest, I don't think any girl can confidently say that they have never faced a sexual violence at least once in their lives. Because even if we don't understand the various natures of sexual violence, all of us have faced at least one form of sexual violence. And I personally have come across issues of sexual violence committed against women, but the unfortunate thing is that the women never receive any sort of justice, and so this is the current reality in our community. Our community are of the opinion that if we talk openly about issues of sexual violences, that will bring bad name to our community. But they don't think that if we were to talk openly about issues of sexual violence in our community, this would actually be an example for other community to follow, that violences of any kind should not be accepted in any community. I think issues of sexual and reproductive health care are issues that are connected to our lives, like everyday life. And most of us know that when we were in school, none of the teachers ever taught us like what it meant to have the changes in our body, or like what could we do if we had period, how do we take better care of ourselves, how to feel confident about ourselves. All of these things were never taught to us, and we know that we could have, like, our life could have been so much different if we would have learned about all of these things, right? So I think it's really important that children know about their bodies, about what they can do if they face issues of menstruation. I think issues of sexual and reproductive health care is important in our community, and especially like because a lot of the young students starting from the age of 9, we start seeing a lot of changes in our body, but nobody tells us why are we facing all of these changes in our body, and there's a lot of confusion among ourselves at that age. And I mean, because we do not know why we're like going through all of these changes, a lot of us face a lot of issues of confidence during that period.